B98.5 with Nina and Tom. Pork roll and eggs.
Good morning. You are listening to Pork Roll and Eggs. Nina and Tom are with you, and something real interesting we're talking about today, FaceTime. If you haven't heard of FaceTime, it's basically a video chat where not only can you hear your friends or whoever you're talking to, but now you can actually see them. But we're going to take it a step further today and talk about this new phenomenon, FaceTime facelift, which is basically people are going to see plastic surgeons because they don't like the way they look on their FaceTime. Now, with us is expert in the field and plastic surgeon, Dr. Adam Schaffner. Dr. Schaffner, thanks so much for joining us.
Thank you so much for having me.
So we're really excited to talk to you today because when I first heard about this FaceTime facelift, I didn't believe it, and my work colleagues had to really explain it to me and say, Nina, this is really happening. Dr. Schaffner's going to come on the line and tell you. So tell us about what you're seeing right now in your practice.
It's really a change in the way in which people see themselves. Traditionally, people would see themselves in the morning and at night and maybe a few times during the day in the mirror. Now they're seeing themselves much more often through social media, through Facebook, through FaceTime, through their Skype accounts, and oftentimes even on their iPhone or iPad. And in doing so, they're not just seeing themselves the way they usually see themselves, which is in the mirror, but now they're seeing themselves the way the rest of the world sees them.
Now, what kind of surgery are they getting done? Like, I would imagine it's mostly their chin, because every time I look at myself on FaceTime, I see my big, dumb chin, and it kind of drives me crazy.
Well, there are a lot of things, and it's not just surgery. It's non-invasive and minimally invasive things that can be done, too. It could be something as simple as wrinkles on the forehead, between the eyebrows, or crow's feet around the eyes. And Botox can help with those very nicely.
Yeah.
It may be that they're getting some of those lines between the corner of the mouth and the corner of the nose, those nasolabial folds, and fillers can help with those. It could be something such as you're suggesting, which would be the chin, whether it's the chin itself, maybe a little too large, a little too small. Things like fillers or chin implants, which are becoming more and more popular, can be done to help improve the profile of the individual. And sometimes it's that midline neck, that little turkey waddle or the there. And there are lots of things that can be done from there to help improve that as well. So it's not just surgery. It should be the whole spectrum of things that are considered.
All right, so now here's my question. Tom and I have a bit of a difference in opinion here. What I feel is that what you're looking at in FaceTime is not actually what most people see you as. You're never that really close to somebody. So the perspective, I think, kind of changes. Like, what do you say to people when they come in and say, hey, Dr. Schaffner, I've been on FaceTime and I'm not happy with my crow's feet or my chin or whatever it is. Can you say to them, well, I don't feel that anything is wrong with the way you look. Most people don't see you the way you're seeing yourself. That's why this is kind of strange to me, because I'm not looking at myself the way these people are seeing each other on FaceTime, and most people don't.
And that's a very good point. And everyone has to have realistic expectations and have a good frame of reference to start with. But that being said, at the end of the day, what really matters is how that individual feels about himself or herself.
Now, how old are the people that are getting these surgeries? Like, is it younger people, or like people in their 20s or 30s, 40s?
It's people of all ages, both genders, and it's not just surgery. It's Botox, it's fillers, it's laser resurfacing.
Now, do you ever turn anyone away? Like, you have someone come in and you're like, well, you don't really, your chin's not that stupid or your nose isn't that bad. Do you ever just turn them away, or you just do everyone?
No, there are many times where I have counseled patients to consider not doing something because I think that the potential likelihood of achieving their expectations is minimal based on what we have available. And sometimes, as you say, that they don't necessarily have an appreciation of what normal is. And there's a lot of variation of normal. If there's a question or concern, by all means, someone should see their plastic surgeon or facial plastic surgeon or dermatologist to really get an understanding of what the issue is and what can be done to help.
Well, that's definitely comforting to know that you're definitely going to tell them the truth. You're going to go through it with them step by step and advise them in the right direction.
Absolutely.
Well, Dr. Schaffner, thank you so much for joining us. You have certainly shed some light on this phenomenon for us. It's called FaceTime facelifts. New York plastic surgeon Dr. Adam Schaffner is with us today. Thank you so much for joining us. And if you guys have questions and you want to talk to Dr. Schaffner, give him a call at 212-688-6600, or you could visit his website at www.drschaffner.com. Okay, great. Thank you so much, Dr. Schaffner, for joining us. You have a great day.
You too. Thank you.
Thank you. Bye-bye.